Hello, and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Jessica Adams. This episode features Dr. Carolyn Chu on improving access and acceptance of HIV PrEP for people who use injection drugs. Dr. Chu is the Chief Medical Officer for the American Academy of HIV Medicine. In this episode, she will discuss how healthcare professionals can improve HIV pre-exposure prophylaxis accessibility and availability for people who inject drugs. For the full online educational program, please visit the link in the show notes for this episode. Now let's get started and hear what Dr. Chu has to say.
People who inject drugs are a priority for the National HIV/AIDS Strategy and Ending the HIV Epidemic initiatives, yet PrEP awareness and use among people who inject drugs remain low despite multiple injection drug use-associated HIV outbreaks. This likely involves multiple factors, including limited access to accurate information, personal risk perceptions, overlapping stigmas and provider bias or discrimination, competing priorities, insurance barriers, and limited engagement with traditional medical settings. Regardless, studies demonstrate that when people who inject drugs gain knowledge about PrEP and its availability, many people are highly interested, especially in long-acting injectable PrEP. Qualitative research and implementation science efforts offer us a more nuanced, comprehensive, and much-needed understanding of facilitators to PrEP uptake among persons who inject drugs. Among other key factors, 3 considerations may support increased access and acceptability. First, PrEP may be most successful when integrated with services that people who inject drugs are already aware of or connected to. This includes not only harm reduction and syringe services and substance use disorder treatment programs, but also peer-based training or educational initiatives, healthcare for the homeless programs, and possibly even emergency departments. Second, PrEP programs should be staffed by people who are trusted by people who inject drugs and delivered in settings where patients feel respected, comfortable, and safe. Third, tailored prescribing practices and interventions such as same-day medication initiation, on-site pharmacies, or medication storage and intensive outreach and navigation, such as transportation or phone access assistance, those may all help support care needs. What's the best PrEP option for people who inject drugs? An encouraging shift seems to be happening with more focus placed on clinical approaches which are not only person-centered, but pragmatic. Which PrEP option is best for a person who injects drugs? Simply stated, it's probably the option that individual is most comfortable with and will take. As healthcare professionals, everyday habits that we can develop are to listen more and avoid assumptions. We can open conversations with general questions such as, are you interested in medications that can prevent HIV? We can offer to share information on PrEP effectiveness, medication and dosing options, possible adverse events, and recommended monitoring. Also, we can ask about what else could support someone's overall HIV prevention and health goals and adapt to patients' experiences and needs. For example, appointment scheduling flexibility may facilitate engagement. We can and should also acknowledge the unknowns. People who inject drugs have been consistently underrepresented in most PrEP research and programming, including the HPTN 083 and 084 trials, which examined efficacy of long-acting injectable cabotegravir. For healthcare professionals serving people who inject drugs with HIV, we can ask patients if they have partners who might be interested in PrEP. Services will look very different depending on local resources and health systems, and therefore community input on program design and implementation will be invaluable. Marcus and colleagues found that PrEP use may increase primary care utilization, such that its benefits might also include the prevention and treatment of additional infectious and chronic diseases, as well as increased use of behavioral and mental health resources. July of 2022 marked the 10-year milestone since initial FDA approval of emtricitabine tenofovir disoproxil fumarate as PrEP. In my practice, the people who inject drugs I care for all acquired HIV before PrEP was even available. And with highly effective long-acting agents now really expanding our options, we have a collective opportunity to not only continue advancing innovation, but also to try and close the gaps where less attention has been placed.
Thank you very much to Dr. Chu, and thank you to our listeners for joining in. Please be sure to check back regularly for more episodes on important infectious disease topics. Thank you, and have a great day.